As healthcare professionals, we know how important it is to stop the spread of the virus across St Catharine's and the wider Cambridge community.
COVID-19 is killing many more people than the flu, and the long-term effects, so-called long COVID, are just beginning to become apparent.
Based on the latest advice from the University of Cambridge and the UK government, the college is asking everyone at St Catharine's to take a number of precautions in order to protect ourselves and others from COVID-19. All the details, including what we need to do in different scenarios and settings, are available on the college website.
There still seems to be a couple of areas where there are room for improvement, based on feedback from student staff and fellows from the first few weeks of term. So we wanted to take a moment to revisit one or two of these precautions and why they are so important.
You will know by now that anyone experiencing symptoms should self-isolate and get in contact with college as soon as possible. So what are the main symptoms of coronavirus? The first symptom is a high temperature. The second symptom is a new continuous cough. This means coughing for a lot more than an hour or for 3 episodes of coughing in 24 hours. If you usually have a cough, this might be worse than normal. The third symptom is a change in your taste or smell. You may have noticed that you can't smell or taste anything, or that your sense of taste or smell have changed from normal.
Most people with COVID-19 have a combination of symptoms, but we should self-isolate, let our household know and contact the college as soon as we experience any one of these. We need to do this immediately and not wait to take a test.
Any student who thinks that they might be experiencing symptoms must contact covid19@caths.cam.ac.uk. This email is monitored 7 days a week by a small team, which includes me.
Sending a quick email to college not only allows us to monitor the possible spread of infections, but also allows us to provide any help or advice that might be needed.
If we do experience symptoms or test positive, this means we need to self-isolate for 10 days from the onset of symptoms or the day a positive test was taken. And we must keep 2 meters apart from anyone we live with to avoid spreading the virus within our household during the isolation period.
We may also be contacted by the college, the university, or NHS Test and Trace. This is because we've been in close contact with someone who has recently tested positive. In this scenario, we are required to self-isolate for 14 days on an individual basis.
As soon as someone we live with tests positive or starts to experience symptoms, everyone else in the household must isolate for at least 14 days. Our students would also be required to isolate as a household immediately if a swab in a testing pool for the asymptomatic testing programme comes back positive.
We are fortunate that so many at St Catharine's are younger people because COVID-19 is in most cases a mild condition or even asymptomatic for this group. Our students' participation in the university's asymptomatic testing programme is essential and has enabled the college to identify and contain several cases that likely wouldn't have been detected otherwise.
Of course, mild or asymptomatic cases might make it tempting to break self-isolation because you may feel well enough to leave home. Please do not let others visit you and do not leave home unless it's an emergency. If you're struggling with the isolation period, please contact college as we have ways to help support you.
We can already see from the early testing data collected so far this term that our behaviour and the care that we take in following the college's protocols determine how well the infections are contained. With your help, we can avoid our community passing on the virus to vulnerable colleagues, friends, and family members.